Hi everyone, thank you for joining us today. My name is Mariella. I'm one of the diabetes dietitians here at SCHC.
And I'm Sally, one of the nurses with diabetes program.
Okay, and today we're going to be discussing some of the most commonly asked questions that we've been receiving from our clients. So I'll be asking Sally a few questions, Sally will be asking me a few questions, and we hope that you find this video to be informative and enjoyable. So we're just going to get started now. So Sally, my first question that I have for you is, how does COVID-19 affect people with diabetes?
Well, at the current time, there's not enough data to suggest that people living with diabetes are more likely to get infected with COVID-19. But people with diabetes or other comorbidities such as heart or lung disease, or even older adults, they're more likely to develop more severe symptoms or complications from COVID-19, including death. And it's generally believed that the more health problem one has, the higher the risk of having these serious complications. And one study actually posed that the risk of fatality from COVID-19 is up to 50% higher in people with diabetes.
Wow. Okay. Thank you for sharing that, Sally. My next question is a really common one, and we have been receiving this question very often. Is Advil safe, especially with everything that we've been hearing in the news? So I think people are going to be interested in hearing the answer to this question.
Well, yes, there's their concerns about how the use of non-steroidal anti-inflammatory drugs or NSAIDs, so such as ibuprofen like Advil or Motrin or naproxen, which is Aleve, it says that it can actually aggravate COVID-19, but right now there's not enough data to just from researchers to support this. Therefore, anyone who are prescribed these medications for the chronic conditions such as rheumatoid arthritis, they should continue to take these medications unless otherwise suggested by their physicians. Abruptly stopping these medications can actually do more harm than good. Acetaminophen or Tylenol is not an NSAID, so continue to be the preferred and first-line treatment for symptoms such as fever and pain.
Okay, thank you for clarifying, Sally. So our last question that I have for you is, are the labs open right now, and is it safe to be doing my blood work?
Yes, they're open, but for urgent testing only, because they're trying to focus more on the resources to do more COVID-19 testing. Just speak with your physician first to see if you can or if you should wait a little bit until the pandemic situation eases up. Some labs such as Dynacare or Life Lab, they both have reduced hours with some location closed right now. So it's best to check their website, or you can just call ahead. You can, when you're actually online on the website, you can actually book an appointment. So you just show up at your appointment time instead of just waiting at the lobby or at the door. They are taking walk-ins, but it's not encouraged because of the physical distancing. Also, they're not doing any COVID-19 at the local labs. So if you are having symptoms such as fever or cough, it's best to go online to the Public Health Ontario website to do a self-assessment online, or just call the public health units, or just call the telehealth, and they'll direct you as to like where to go, like the assessment center, and get tested and like that.
Okay, thank you, Sally. So now we're going to be switching gears a little bit. Sally's going to be asking me a few questions around staying healthy during this time.
So the first questions I have for you is, what should I be drinking to stay hydrated?
So ideally we want to be staying hydrated with water. So this is the recommendation that we've always had even before the pandemic began. So the recommendation hasn't changed. So the usual recommendation of having around 8 glasses of water a day is still there, and it's still the recommendation. Water does help with our digestion, and it can help prevent weight gain during this time. Especially right now, most of us are going to be less active compared to before. And as we know, water does not have any calories, so it can help with maintaining our weight, as compared to other beverages such as sugar-sweetened beverages or other flavored types of beverages. You can also consider adding natural flavors to your water, such as mint, lemon, or even lime. The other thing I wanted to make a note of is to limit or try to limit the consumption of sugar-sweetened beverages, as this will increase our risk of having uncontrolled blood sugars in the case of someone who already has been diagnosed with diabetes. It also can contribute to weight gain, especially during this time when we are going to, most of us anyways, are going to be less active compared to normal. And the last thing I'll mention is around alcohol. So the recommendation to limit consumption of alcohol is still the same as before. We know that drinking more than moderate quantities of alcohol may lead to a variety of different health concerns. In addition, alcohol doesn't really have much nutritional value to offer us, and so it will offer extra calories, however, and that may contribute to weight gain.
Okay, thank you. And I want to make sure that I'm eating fruits and vegetables or to stay healthy during this time. But I don't want to buy fresh produce only for it to go bad and go to waste. What do you recommend?
Yeah, so that's an excellent question. So there's some points to keep in mind, especially during this time when public health officials are recommending for us to really limit our trips to outside our home. So that means going to the grocery store maybe once a week or even less often than that. So really choosing fruits and vegetables with the longest shelf life can be a good strategy to keep in mind. So fruits with the longest shelf life include apples, oranges, grapefruits, and pomegranates as some examples. Vegetables with the longest shelf life are any kind of squash, any kind of potatoes, turnips, parsnips, cabbage, and beets. Something else to keep in mind is frozen vegetables and fruits is a really good option. You don't have to worry about the nutritional value of frozen vegetables and fruits being any different than that of fresh produce, and that's because frozen vegetables and fruits have been picked at their peak ripeness and been frozen at that time. And then the other thing about frozen vegetables and fruits is you can simply just eat whatever you'd like at that time and then put the remainder back in the freezer. So there's limited risk of those vegetables and fruits going to waste. And so from that perspective, it's also a cheaper and more economical option. The last alternative or strategy that I'll point out is if you are going to be choosing vegetables and cooking vegetables that have a shorter shelf life, in order to limit the amount of waste that someone is consuming or producing, you can simply cook those vegetables, eat whatever you'd like at that time, and you can place the remainder in the freezer to be consumed at a later moment in time.
Thank you. Last question. I'm living alone and find it difficult to eat a meal by myself. What should I do to help ease the isolation and loneliness?
Okay. Yes. So this time is especially difficult for people living on their own. There may, however, be some strategies to consider to help ease this loneliness that many of us, even those not living alone, may be experiencing. So really getting at that social connectedness piece. So if you do have available technology, consider FaceTiming with friends, family, or neighbors at least once weekly, and you can try doing this during meals. So platforms such as WhatsApp and Zoom allow for multiple people to be socially connected, socially engaged at one time. You can also consider baking dates with friends and family through the FaceTiming options and platforms. Okay, so maybe you have a recipe that you want to try, so you might find it cool to maybe try it out with a neighbor or try it out with your friend or a brother or a sister. So you can do it through Zoom, and both of you can be baking at the exact same time. So it's another way to be socially engaged. And then the last thing I'll mention is that not everyone does have access to technology, and then some people may not feel very comfortable with using technology. So in that case, simply using a telephone and calling a friend, neighbor, or family member and putting them on speaker as you're having your meal together or as you're engaging in an activity relating to cooking or any other kind of activity, that can also be very helpful and a good alternative and strategy during this time.
Okay, thank you. So this concludes this clip for today. We will be making more as we get more questions or suggestions from our clients or even other staff. So if you have any suggestions, please feel free to contact us and let us know. And keep checking our website for future clips to come. Thank you.